talk about health care. You know, ever since Donald Trump was elected president, we're hearing on the news all the time about how bad our health care system is, especially Obamacare. Well, as the Republicans go out and meet with their constituents, they're having these near riotous conditions because people are so nervous about what's going to happen to their health care. I think that when we talk about health care, there's an elephant in the room that nobody wants to address. I'd like to talk a little bit about that elephant in the room. One of the things we hear a lot about is how these insurance companies just aren't making money, and so they're pulling out of these health collectives. Well, you see, that's the problem. These healthcare companies think that they have to make money, and apparently the population of the United States agrees with that. This is the elephant in the room, and this is the problem that we're having. You see, in our country, we pay up to 3 or 4 times more than other developed countries pay for our health care. And our outcomes aren't that good. The World Health Organization did a study of 190 countries, and the United States ranked 37th, in spite of the fact that we pay so much money for this coverage. Our life expectancy is at the bottom of the list compared to the top 10 industrial countries, and our infant mortality rate is very high. Why we got into this problem at the end of World War II is beyond me. Most of the other advanced countries decided to socialize their health care, and they've been doing just fine with it. But on the other hand, the United States decided that we would privatize this, that we would put health care into the whole idea of profit, market-driven, capitalism. Somebody has to make a profit. Consequently, we have these insurance companies that have shareholders that have to make money, that have way overpaid executives that have to make money. Some of these executives in the insurance companies are the highest paid of any executives anywhere. Some are making over $100 million a year. Well, how that translates to us down the line is our premiums are very high. And what happens is we don't get the service that we should, because how else are they going to make money? Let me give you an example. I have a very good friend who has an insurance agency. For years, he specialized in life insurance, and he said it worked great. In life insurance, you pay your premium, you pay your premium over the years, and then when you die, your family gets the money. He then decided to go into healthcare insurance and pretty much regrets that he did. He told me that here's what happens. You buy an expensive policy, you pay your premiums regularly, you pay and you pay and you pay, and then when you get sick, the insurance company, the healthcare insurance company, tries to find some way to not cover your expenses. Something like, well, Mrs. Johnson, we'd really like to help, you know, but I'm sorry to tell you that this particular kind of pancreatic cancer that you have just isn't covered in your policy. I'm sorry. So then Mrs. Johnson gets to sell her house, take whatever assets she have to pay off these gigantic medical bills, and then live in abject poverty for the rest of her life. This is stunning. It seems as though the way that these insurance companies make money is to find ways to deny giving you the benefits that you've been paying for all this time. What a system. Seems to me like we should have a system that's more like how we cover fire insurance, for example, in our communities. We all pay our taxes to support the fire department. When my house catches on fire, I can depend on the fire department coming over and putting out the fire. Now, imagine if that industry ran like the healthcare insurance industry. The fire department would come to my house, which was burning, and they would say, well, Mr. Gilbert, did you pay your insurance? And if I did, then they'd help put the fire out. Or they might say, well, Mr. Gilbert, we've reviewed your policy. We know my house burning in the background. Mr. Gilbert, we have reviewed your policy, and we've noticed that your fire started in the attic. And you see, Mr. Gilbert, your policy doesn't cover the attic. No, of course, we don't do fire insurance that way. We all pay for fire insurance out of taxes we expect to get the service. This is precisely the way that healthcare should work. We shouldn't have healthcare insurance. We should just have a system that guarantees every citizen healthcare coverage from the time they're born to the time they die. What shocks me is why our fellow citizens aren't up in arms about this. So why isn't it that people are not demonstrating in the street and being outraged about this system? I would like to suggest that since the time of Ronald Reagan onward, the right wing has done a great job of persuading people that people at the top need to have all the tax breaks because they're the ones who know how to run things, and it's okay for us to give them lots of money. Our money has been going upstream from the working class and the poor into the pockets of the 1%. And nothing demonstrates that better than our healthcare insurance industry. It makes sure that the small doctor collectives remain very, very lucrative for those people. In other words, our healthcare insurance industry is not designed to serve us, the client, or the patients. It really is designed to ensure that the people at the top in these healthcare industries, in the pharmaceutical industries, and in medicine remain as rich as they possibly can be. And I think until we kind of get on board with understanding why that's happening, we're not going to see a lot of demonstrations in the street. You know, another thing that is a little confusing to me about the current system we have is why it got set up that your health care has to be handled through your employer. What is the logic in that? It's a huge burden for employers, and it keeps people stuck, perhaps in jobs that they don't like, just because they're afraid to leave because they're going to lose their health care. If we had a national system in which you were born into it, and you always pay taxes to support it, but that it doesn't have anything to do with where you work, so that when you leave your job, you still have your health insurance. If you're unemployed, you're still covered because you're covered under the national plan. I remember a few years ago, I heard Lee Iacocca give a talk. He was then chairman of Chrysler, and he commented on this business of government support. And he said, in our system, we really put a lot of handcuffs and restraints on our corporations. He said, for example, when he sells a Chrysler, there's about a $700 cost that's built into that for the health care of the workers. He compared that with the Japanese model, in which the workers' health care is taken care of by the government, and so the car companies don't have to cover that cost. And he said it's impossible for him to compete with some of these Japanese car companies on price because of that one expense, the $700 per car. Years ago, before I was eligible for Medicare, my family and I, my wife and my daughter, we all belonged to Kaiser, and we paid, I don't know, roughly $15,000 a year to Kaiser. Now, we're very happy with that Kaiser program, by the way. But what would be the difference? So we have a nationalized system, and instead of paying Kaiser the $15,000, I pay taxes, and the government runs the whole plan. You know, what you see in this ridiculous private system we have now, constant ads all over TV for this stuff. You have very high-paid executives, and you have shareholders who want their money. They're investing. You know, for Medicare, which I think works just great, I don't ever see any ads on TV. I'm not aware of high-priced executives in Medicare. And that's the system that we need to have for healthcare as well. You know, one of the things I've noticed is that people who defend our system, so excited about our fee for service capitalistic model, will often tell you that, just look at the Canadian system and what a disaster that is, and how these Canadians are always streaming across the border to avail themselves of the American system. I, I, I often do this just for the fun of it. Every once in a while you meet a Canadian. Maybe they're here on a vacation or something. And one of the things I'll say to them is, wow, we really hear what a terrible healthcare system you have up there and how you're under the thumb of this oppressive government system. And you know what you get from the Canadians? They look at you with startled eyes and say, what are you talking about? We love our system. My good friend John Warren, who was living in Italy at the time, visited Ireland. When he was in Ireland, he got deathly ill. He had pneumonia. He had to go into a hospital in Ireland. And for 3 days, he was in intensive care. They were giving him, I guess, IV intensive antibiotics. He was in the hospital for 5 days. When he got better and he was ready to leave, he went to pay his bill. And you know what they said to him? Well, there's no charge. Think of that. There's no charge. John wasn't even an Irish citizen. He was a tourist. How does that happen? I'll tell you how it happens. The people in Ireland make a decision to tax themselves to give health care not only to themselves, but visitors. Can you imagine being a tourist in the United States and you get deathly ill and you're in the hospital for a week? When that's all over, the United States would say to you, here's your bill for $500,000 for your week's stay in the hospital. Good luck. Thanks for visiting. It's absolute nonsense. Oh yeah, let's not forget about death panels. Our friend Sarah Palin used to say that the problem with government health care is there are going to be death panels. Well, hey, I've got news for you, Sarah Palin. You're right. Imagine that. I agree with Sarah Palin. Sarah, you're right. There are death panels. But Sarah, it's not the evil government like you think. You know who it is? It's the goddamned healthcare insurance companies. That's who it is. They have acres of people sitting at desks with actuarial tables, and they're calculating whether or not your grandma should have a heart transplant because she's too old. Those are the real death panels, Sarah, not the government. And by the way, if I think about it, if we did have government socialized health care, there probably would be government death panels, because somehow you have to spread over the resources that you have. And it may just be that my 94-year-old grandma just doesn't get a heart transplant because she's too old. And we take that resource and we give it to younger people who can use it more. So, Sarah, in some funny circular way here, you're wrong about government death panels. And if we do get socialized medicine, then maybe there are government death panels. And oh, by the way, let's call it socialized medicine. Let's not use these sort of weasel words like Medicare for all, single payer, nonsense. We're talking about socialized medicine, which means we all pool our resources to support each other. It's not every man for himself. Those days are gone. Our country is too far advanced to think that it's this rugged individualism, Daniel Boone out there, John Wayne, once again, every man for himself. No. We have to realize that in today's world, we have to work together to support each other. And if we want to call it socialism, that's okay with me. You'll often hear people say, well, our healthcare system is the best in the world, and people flock here for their surgeries and take advantage of our system. And what always cracks me up is I say, okay, well, let's look around at these other governments, these governments that have this dreaded socialized system, like Norway and Sweden and Denmark and Holland and France and Germany, and it goes on and on, Canada. wonder why we never see candidates for public office in those countries running on the American plan. You just never see these people saying, well, my policy is that we're going to adopt the fee-for-service, capitalist-based, profit-based system that they have in America. No, you don't see that. Why? Because people in these countries are very, very happy with the plans they've got. So in summary, the elephant in the room is that the healthcare insurance industry has persuaded us all that this should be a fee-for-service, market-driven, profit-driven industry. I would like to suggest that you write your legislator, congressman, senator, whoever it happens to be, and let's start a little movement. And the movement will be something like this. The entire healthcare insurance industry should go away. We got it started after World War II, big mistake. And so now what we're going to do is just simply decompose all this whole thing. We don't need it anymore. What we now have is healthcare for everyone. I heard one commentator recently say, this doesn't have to be a complicated problem. What we do is we take Medicare and we reduce the age of eligibility for Medicare to 0. Therefore, people are covered from birth. Well, I hope that you have enjoyed my little rant, my diatribe. Hope you agree with me. Or if you don't, I hope maybe I've helped to change your opinion in some way. Thank you very much for watching this, and until next time, so long.